generally speaking, when we say stomach, we refer to the entire tummy, we call that stomach. But in the medical terminology, when we say stomach, it actually means a specific part of the gastrointestinal tract. So when you take food, you have the pharynx, which is the throat, which is there in the throat, that connects to the esophagus, which is the food pipe, and that goes and joins the stomach. The stomach is like a big pouch, a bag, you can call it, in the tummy, which actually is a food reservoir. It forms the function of a reservoir. So when you eat food, what it allows is, it allows you to have a fairly large quantity of food at one go, so that you can eat only 2 to 3 times a day. So when you eat food, what happens? The food goes into the stomach, it gets stored inside the stomach. The food you eat gets mixed with the intestinal juices and the gastric acid, which makes it into a much finer which gets churned into a much finer composition, which we call as chyle, and that gets gradually released into the intestines and the digestive process occurs. So this reservoir function is the main function of the stomach. So gastric cancer is when you have an abnormal proliferation of cells within the stomach wall. So when the stomach wall proliferation, most of the time when we say gastric cancer, we refer to adenocarcinoma. 95% of the tumors of the stomach are of the variety of adenocarcinomas, which is the tumors which arise from the cells which are lining the stomach wall, the gastric lining. There's a separate type of cells called the columnar cells, which line the gastric wall, and when these cells proliferate, they cause adenocarcinoma. Usually the gastric cancer, before it occurs, a couple of years, 2 to 5 years before itself, you have precancerous lesions. These precancerous lesions over a period of time convert into malignancy. So like I said, 95% of the tumors we deal with are tumors from the gastric lining, which we call adenocarcinomas. About the rest, other 5%, we have rarer tumors. The 2 commonest varieties in these are, one is called GIST, gastrointestinal stromal tumors, which arise from the muscle wall, specialized cells within the muscle wall of the stomach. And then you have the lymphoma. Lymphoma is from the lymphatic cells, the immunological cells which are within the stomach wall. So these 3 tumors, adenocarcinoma forms 95%, 5%, and the other 5% is gastrointestinal stromal tumors and the lymphomas.